Hello, my name is Dr. Ryan Anderson. I'm one of the co-founders of TLOSU. This webinar focuses on something that is often an emotionally challenging topic, but also something that we have found to be incredibly important. And we want to help walk you through some of the ideas and things that will help us as we work with you on this during your time at TLOSU. And that is parenting after a divorce. Now, we have a certain number of our families coming to us where the parents are divorced, but trying to work together with us on issues that their child is struggling with. And as much as there are difficulties in trying to help the child, there are difficulties and challenges in trying to parent after a divorce has occurred. So today we'll be exploring important ideas, giving some tips for things we'll work on with you, but also giving you for some guidance for things that you should probably think about working on yourself to help you in this challenging area. So there is a caveat before we get started. Everything we're about to talk about today in this webinar is making a specific assumption. It is assuming that there has not been spouse abuse and that there has not been child abuse leading into the divorce. Now, there's a very big difference between abuse and simply just not liking each other anymore, or having differences, or having arguments. So, if you have some questions or concerns about whether what happened in the past constitutes abuse, this would be something for you to talk to the therapist about. But when real abuse, genuine abuse, has been a part of the family history, then there are a variety of different recommendations that we would make about how to approach this situation. So, if that has been the case for you, or if you're concerned that it might have been the case for you, this is something definitely to discuss with your child's therapist. But going into this, keep in mind everything we're about to say today assumes that abuse is not a part of what has happened. Now, I also want to acknowledge several things. First of all, divorce, no matter what led to it, no matter whether you were the one who instigated it, or it was mutually instigated, or it was something that happened and you didn't want it to happen, divorce is always profoundly painful, regardless of the circumstances leading up to it. It's important to also recognize something that you've probably learned. A lot of times it's easy for us to think that when we get divorced from someone, that is the end of that relationship. We quickly learn that that is not true. It is a reorganization of the relationship. The relationship does not end. And in fact, it especially does not end when there is a continuing parenting issue going on, a need to parent together. It's also important to recognize that divorce is not something that happened when the divorce decree was signed. Divorce is an ongoing state. That is certainly the way that the children experience it. And it's important to acknowledge that in the way that we approach it. And so, with all of that, with all these complications, difficult emotions that are a part of divorce, the idea of some kind of collaborative parenting with your ex spouse or ex partner can be very emotionally challenging. And so it brings up the question, why would we even want to do it? Why would we recommend that this is something that we need to work on, given all of those emotional complications and how painful and difficult it can be? Well, there is an answer to that. And the answer is found in the research in this field. And the research shows that, again, in the absence of abuse, some form of effective cooperative parenting after divorce leads to not just slightly better outcomes, but much better outcomes for the children. Now, also keep in mind, it's not just that you're cooperating somehow, the quality of the cooperation is a major contributor to how much improvement there is, or whether there is any, when it comes to emotional, social, and physical outcomes for the children. So keep in mind that when there is an absence of cooperative parenting, as well as when there's the presence of high conflict, or when you're trying to cooperate, but it's just not going well, that there's a lot of conflict and undermining and things going on, that has been shown to contribute to behavioral and emotional problems for the child. So the whole idea is that this will either help or it will hurt. But we can't hide from it. We can't run from it. We can't try to sweep it away and hope that it's something that just won't affect the situation. Because ongoing conflicts and ineffective or undermining parenting after divorce is also not just a slight contributor, but a significant contributor to psychosocial difficulties for the children. So we can try to deny that fact, or we can try to ignore that fact, but we do so at the child's peril. And they are ultimately the one who will pay the greatest price if this is something that we're not willing to acknowledge and do something about. So we either address this issue or we suffer its outcomes. And we can't hide from it. Some people have asked me before, well, how is my child even going to know if there's some kind of cooperative parenting going on between us or not? How are they going to know if we're continuing to argue or fight? Well, while I understand that question really underestimates the children, specifically in two areas. It underestimates their perceptive abilities. And this is true even for people who have difficulty with social perception. They pick up on the conflict, even though we're trying so hard to hide it. And also, it underestimates the degree to which effective cooperative parenting is palpable. You can feel it when it's going well, and you can feel it when it's not. And it's just something that you can't really mask or hide. So, of course, when we're talking about doing this, I recognize that there are multiple layers. And the ability to cooperatively parent after divorce depends heavily on your ability to manage your own emotions, specifically around the divorce, specifically around the way that impacts your feelings about yourself, about the other parent, and about the child. And so at the beginning of all things, this is about how you manage emotions. And if you're not being successful with that, if that's something you're struggling with, everything else you try to do will be a struggle as well. And again, I'm not trying to minimize things. I recognize that there are tremendous layers of hurt and other complicated emotions. So it's not like, hey, this is easy. This is challenging, but it is something that you need to learn how to do if it's something you're still struggling with. And remember, as you sent your child to Telos, you are asking them to learn to deal with their most difficult and complicated emotions. You cannot ask that of them unless it's something that you're willing to do as well. And in fact, if they can see that they're being required to work on that and you're not, it just tends to build resentment and slows down or even creates barriers to their progress. So, this again is something that we really cannot deny or ignore. Now, there are a number of tools that you can use to help you in this process, and some of them are things that we can do for you here at Telos. One of our recommended, or I would even say required reading pieces is The Anatomy of Peace. We also have several associated webinars and trainings and tools around that. This is a powerful tool for learning to create peace where there was conflict. Another resource that we might recommend to you is a website called uptoparents.org, which offers free and high quality training on how to parent after a divorce. This is also something where we would often strongly recommend that this is something you seek personal therapy on as well. For most people, this is something that they're going to need more help with beyond what we work on in our family therapy sessions, because it can't be the primary focus of our work. So there are a number of different modalities we might encourage you to look for, things like DBT, mindfulness, EMDR, CBT, all things to learn to help you work with your difficult emotions. But keep in mind, if this is something you're struggling with, it's probably something you'll need to work on in addition to the work we try to do with you directly. Now, when we think about cooperative parenting after divorce, there are two general categories. The first category is actual co-parenting. Now, that tends to imply that there are multiple touch points between the parents, things like texts, emails, phone calls, and regular discussions about ongoing items. So typically, there's more frequent consultations and decision making between the two parents around common decisions. And this may also include efforts to try to closely align parenting styles between the two parents. Now, more commonly, especially when the divorce has been particularly difficult, parents usually fall closer into the category of parallel parenting. Now, that has more limited communication and collaboration. So it's not necessarily a day to day discussion of things that are going on, but it may be talking about important things as they're coming up, calendaring together, things like that, but doing it more at a distance, usually through the written word and less through phone calls and other things like that. There's usually more of a focus on mutually agreed upon parenting plans and parenting principles and approaches rather than individual smaller decisions. And even though this tends to be at more of a distance, there is an increase in communication and collaboration around major needs and decisions for the child. Now, that being said, if your child is in residential treatment, and they currently are, then their current work and needs absolutely fall into the category of major needs and decisions. So, even if for the most part you're working on parallel parenting, this is one of those occasions where your degree of collaboration and communication and cooperation needs to increase in order to allow us to be as effective as possible. We're not asking you to adopt a full co parenting approach if parallel parenting is what you're doing, but we are asking you to recognize that this is one of those times where we need to increase contact and collaboration. Now, there are some common factors between parallel parenting and co parenting. Both of them include a focus on creating a peaceful experience for the child and not involving them in conflict between the parents. And there is an absolute focus on the child's needs and evaluating them and seeking to make those what guide decisions. There is a very big focus on refraining from using the child as a pawn in conflicts or accusations between the parents. And there is a constant need to separate the parents' personal feelings about the divorce and about each other from the children's feelings about each parent. They also have strong boundaries around parenting issues versus divorce issues. You can talk to the child about parenting issues. You will not involve them in discussions about the divorce or the ongoing divorce dynamics between the parents. And also, both parallel parenting and co parenting have parents keeping each other in the loop with developments with the children so that they know generally what's going on in both locations so that they're able to support each other. And there is a focus on seeking to create a stable team that supports the child. The message is that although our marriage has ended, we love you enough to make sure we're working together for your well being. There are some things that you need to absolutely avoid doing. First, do not talk negatively about your co parent to your children under any circumstances at any point in time. Second, never ask your child to take sides between you and the other parent. Also, don't try to keep your child away from the other parent out of anger or spite. The only legitimate reason to try to withhold a child from having contact with the other parent is when there are concerns about safety. Also, never ask your child to spy on the other parent or put them in a position where they have to work as a go between you and them. It is your job as parents to communicate with each other and not to try to involve your child, no matter how old they are, in that process of passing or gaining information. As you create a mutually agreed upon parenting plan and approach, both of you need to make sure you're putting forth honest effort to be consistent in following that plan. And as you make promises, make sure that you keep those promises. So be thoughtful about how you go about making promises and commitments, that they're done in a way that both sides, both parties are aware of and can agree to, so that they're not undermining each other. Also, one thing that often happens in family therapy during the parent consultation portion, it's not uncommon for divorced parents to try to win the therapist over, to have them take their side and to label the other spouse or ex-spouse, I should say, as being the one who has messed up the child, quote unquote, or being the one at fault. This is not productive. Keep in mind, the therapist's job is not to take sides between parents. It is to help both of you take a look at how you can work together to function as a supportive parental unit for your child. We're aware that both of you have strengths, and we're aware that both of you have weaknesses. And when you try to focus on pointing out the other person's weaknesses, you are actually impeding your own growth and your ability to be effective in helping your child. Also, do not seek to rally other family members against your ex. And recognize that in this process, it's going to be requisite for both you and your ex to tolerate some degree of discomfort that comes along with working with each other in order to be able to meet your child's needs. So, what this means is that both of you have to come into this recognizing, yes, you have been hurt, but it is your job and your role to seek to develop and to deploy emotional maturity in the way that you approach this parenting issue. Also, keep in mind that if you and the other parent are not communicating and you're not attempting to cooperate, your child is likely to have one or both of the following responses. Number one, they often will feel like they are responsible for making the parental cooperation work, that they have to work as a go between. That's not a good boundary. That's not a good role for them. It actually causes tremendous strain on them and leads to mental health issues. And the second is that they will lose trust in both of you as parents. They'll lose trust in your ability to act in a mature way to work for their good. Now, trust is incredibly important. It is the bridge that you will need to cross 1,000 times in the course of your child's growth, development, and healing. So you can't afford to damage it, especially because of difficult feelings between an ex-spouse or partner. So that's one thing you have to keep in mind is every moment you're working on this, you're either raising your child's trust and your ability to act in their best interest, or you are losing their trust in that area. This is an important thing to recognize. So there are a number of basics that we would want to encourage you to think about and to work on from the very beginning. As we mentioned before, keep each other in the loop about developments with your child. So you need to help set each other up for success by sharing vital information. Also, one of the things you don't want to do is to be on a call with your child and the other parent and blindside the other parent by bringing up something with the child that you and the other parent haven't discussed previously. You also want to make sure you give each other a heads up about any discussions you have with the child in private phone calls so that both people are aware of what things are developing. This is basic courtesy, and this is making sure that you're not blindsiding each other. Second, recognizing that you have difficult emotions towards each other, you want to make sure that you're communicating in the right time, in the right place, and in the right emotional state. So, first of all, you want to make sure that you're giving information in a timely manner. Don't leave the other parent hanging. But also, don't email or text or call when you're angry or frustrated or anxious. Your job is to work on dealing with your anxiety, your anger, your other difficult emotions first. And once you are in a more emotionally stable place, then you can reach out and try to communicate about what needs to be communicated. Second, I should say third, you need to work on slowing down your emotional reactions. When a divorce has occurred, both sides have learned a lot about each other's buttons, and both sides have developed a pattern of both pushing buttons and having buttons pushed. Now, in all of this, you need to be aware of your own buttons. And you need to slow down and work on that process of not being reactive to things that might feel like a rerun of old button pushing. So you also personally need to make an active choice to genuinely try to not push the other person's buttons. But it's not a case of, okay, let's try to catch you doing the things you did. And at that point in time, I'm going to just become reactive. This can be challenging. And again, this is one of those things we encourage you to seek some of your own therapy to assist you with. The fourth aspect is to make sure that you are dealing with the situation and decisions that are in front of you, rather than all of the history that's behind you. You don't want to pile on all the disagreements and disappointments of the past. That's too much to deal with, and it will just stress your child out. You also don't want to jump ahead and fortune tell about the future. Yes, we need to be thoughtful about how things are going and the direction they're moving in, but we need to work with one problem at a time, one day at a time, and need to be okay with focusing on incremental growth and not bringing in all of the pain from the divorce into every decision, every challenge, every moment we're working on with the child. Also, you need to learn to really listen to each other. Most of the time, when there's been a divorce, listening has broken down, and both partners have to learn to listen again, specifically to find common ground and mutually workable decisions in the best interest of their child. So, again, don't listen to argue or to shoot down. You're listening to collaborate, not just to respond. The sixth piece is also to make sure you speak to each other with respect. No good is going to come from being testy, rude, or sarcastic with each other. And anytime you try to score points in this way, everyone loses. There is no good that comes from this. So, again, this will require you to look at how you're dealing with your emotions around this. And if you notice that you're feeling tempted to speak disrespectfully, don't just work on your language, continue to work on how you manage your emotions. Also, when you speak about each other to the children or child, again, speak with respect. Absolutely no bad mouthing. And especially, above all, do not try to recruit your child in some kind of critical alliance against the other parent. To do so will ultimately undermine not only the other parent, but you as well, and will teach negative learned behaviors to your child. Now, going into all of this, you will both make mistakes sometimes, and it's very easy to try to be focused on what you think the other parent is doing wrong. However, that is not beneficial. You need to be dedicated to being focused on your personal efforts to communicate, collaborate, and make decisions. And when you feel like the other parent is making mistakes, again, continue to focus on your personal efforts and trust that the therapist is taking a look at the larger picture and helping both of you take steps one step at a time towards growing and improvement in this area. Also, it's very important. There are a lot of things that can eclipse and be what drives the bus, so to speak. But the one thing that really needs to be the decision maker are what the child's needs are, not the personal preferences of either parent or old points of contention. Keep in mind, there are multiple legitimate ways to meet your child's needs, and you always need to go back to this as your number one priority. Also, keep in mind that if you're in a competition with each other, if there's this desire to win, to beat out the other parent in some way or other, if you make things about a competition, then all of your victories will be a loss. They will have a heavy, heavy price associated with them. This is not a competition between the parents. This is about making sure we evaluate and respond to the child's needs. Also, be very careful not to undermine one another. There are lots of ways that this can happen through trying to override what the other parent thinks or feels, trying to make under the table deals with the child, competing for affection, bribing. There's so many ways. Keep in mind, anytime you do something to undermine the other parent, you also undermine your own credibility. Both parties lose. And who loses the most is the child. So, in the process of working at Telos, there are a couple of things specifically we need to ask from you to help make sure you don't undermine each other or us. First of all discussions, and I mean all discussions, about treatment, visits, privileges, structure, boundaries, timelines, goals, and planning for after treatment should include both the therapist and the other parent. There should never be any discussion about these that does not involve those three parties. Also, it is best for both parents and the therapist to discuss possible options and ideas before they are presented to the student. This helps prevent unintentional undermining. Also, and this is very important, do not try to control your ex. First of all, you can't. You're just not going to be successful in doing it. Second of all, if you try, all you will do is spark conflict between the two of you. So, in this process, again, we ask that you trust that the therapist will try to work with both of you on improving. That doesn't mean we're going to shut either of you down every single time that there's some kind of a mistake. You are both a work in progress. We are all works in progress. And we will work on this one step at a time. So you may see what you perceive as an error or a mistake or a problem in your spouse, and you may feel concerned, sorry, your ex spouse, that is, and you may feel concerned that the therapist didn't quite respond the way you wanted them to. But keep in mind, the therapist is aware of the issues, and we are working on these things at the speed that you're both able to work on them. So it's not your job to call fouls on your ex spouse or partner. Your job, again, is to stay focused on what you are doing to be an effective parent and to help create safety for your child through cooperative parenting efforts. Also, keep in mind, you will continue to have differences. You won't suddenly come to a point where you see everything eye to eye, but how you deal with your differences, that process will be one of the most important and most impactful things you can do for your child. In fact, one of the best things you can do to promote their healing. So, the process of managing your differences is crucial, and all effort you put into it will be well invested time and energy. Also, you'll want to make sure that you work together, and the therapist can assist with this in developing shared boundaries, principles, and non negotiables. In that, though, both of you need to open up room for individual parenting styles as long as we're working on sharing those same boundaries, principles, and non negotiables. And also, this is one of those areas where you will need to check in on yourself regularly. This is challenging work. It does get easier over time. But also, if you become complacent about it, it tends to fall apart and experience entropy. So you'll need to check in on how you're doing regularly. This includes both self evaluation, but also getting good feedback from someone you trust who won't just encourage you or tell you that they think you're right all the time, but someone who will give you realistic and helpful feedback. Now, this is hard work and it's dealing with emotionally challenging things. But if you're willing to embrace it, we promise that not only will it help heal your child, it will help in your own process of healing from the pains that have been a part of the divorce. And also, above all things, this is the most important thing you can do to help your child. They need their parents still, and they will continue to need you as parents as they go through their lives. That will grow and evolve. But your relationship with them and your ability to show that you love them enough to work effectively together in parenting them is one of the most liberating and empowering things you can do. So, we are here to help you, and we hope that you will embrace this challenge as a part of your experience at Telos U.